Okay.
Thank you. Well, I wanted to really start with a really basic understanding of a sexual assault response team. And I also want to say that, across Indian country, tribes are just now developing sexual assault response team for the most part. Some tribes have maybe had some in place for maybe about 5 years, I would say. But for the most part, most tribes are just now looking at developing SARTs within their tribal communities. So I wanted to start with a really basic understanding framework of the SART development work, and beginning with kind of a broad definition of what a SART is. It's a multidisciplinary team that provides specialized immediate response to adult or adolescent victims of recent sexual assault. And again, I highlighted specialized and immediate. Really, that is the focus of a lot of SARTs, is to develop a specialized response. Specialized meaning specialized to the unique needs of a particular tribe, their criminal jurisdiction, for example, if it's federal, state, or tribal. Specialized from the perspective of each of the disciplines that are participating in the SART, specialized in the context of what victim-centered response would look like, and I'll talk more about that. Specialized from a cultural perspective as well, and then also immediate, meaning generally the response is focused around sexual assault that's occurred like within the last maybe 96 hours, and some are looking even beyond that in terms of how long evidence can be collected. So the protocols that are associated or developed within a SART really focuses on an immediate response. And then also a lot of SARTs are first developing their protocols around the needs of adult victims, but also many of the adolescents have similar needs as adult victims of sexual assault. So I was asked one time, do we have to call it a SART? And not necessarily. I think for the sake of consistency, I think most tribes have adopted that term. But I always say, you can call it whatever you'd like, and including something that is unique to your tribal identity. But the definition here came from the national protocol. There are several purposes of developing SARTs, and I've listed a few here. And again, it's to coordinate immediate response. Those first few hours are really critical in terms of providing a really good response to victims of sexual assault. If we can enlist their trust, I always tell service providers and responders, we all have some things in common. We all have some differences in terms of how we do our work, but we also have some commonality, and the one thing we have in common is the victim. And we also have in common that we're looking at providing good services for that victim, because, we need that victim in terms of developing a case or building a strong case for prosecution. It's to provide immediate response such as crisis intervention, emotional support, information and referral, advocacy for victims, and also family members and relatives by trained sexual assault advocates. So the involvement of advocates in the early period of the response is really important. Having that advocate work with that victim as soon as possible when they present either to law enforcement or to the emergency room, having the presence of that advocate is really important, because then they have someone to provide them the emotional support and all the necessary services and information that they need in order to make informed decisions. Prevent the victim from having to repeat personal accounts of the assault. Before the creation of sexual assault response teams and also sexual assault nurse examiner programs, victims would often have to tell their stories numerous times when they presented at the emergency room. I think I counted one time like 7 times they would have to tell their story. So the SART really minimizes that somewhat. There's also some evidence, some research that shows that there is some benefits to repeating the story. Sometimes it takes away the power of that sexual assault and becomes a little bit more I don't know what you'd say, tolerable or not tolerable, but palatable or something for that victim to talk about it. It somehow sort of minimizes the power that sexual assault has. But there's also some concerns about, if they have to repeat the story several times, and if that story changes, what does that mean for the defense, for example? So, but I think for the most part it is a benefit to have less times for the victim to repeat the story. To provide victim-centered services to minimize, eliminate further trauma to the victim. And I'll talk more about victim-centered services in a minute. Utilize tribally specific practices of helping, healing, and justice in order to ensure the safety and well-being of victims and the community. Every tribe has had their history of what justice means and how they provided justice for people who were harmed by violence. And this is an opportunity for tribes to regenerate some of those old traditional practices. To prevent confusion among professionals trying to meet the needs of the rape victim. Before SARTs, people sort of operated in seclusion or without a lot of communication. In fact, between some service providers or disciplines, it's been the relationship's been kind of adversarial. For example, like between advocates and law enforcement, there's been some not always real positive relationships. Or even between prosecution and law enforcement. Prosecution says, well, if law enforcement investigates better, we might be able to charge more cases, and vice versa with law enforcement. Well, we investigate really well, but they still don't charge cases. So there's been those kind of discussions and conflicts in the past. So the sexual assault response team really creates a good venue for people to come together and discuss, some mutual concerns and how to work together in better harmony and cooperation. Provide timely, thorough, and professional medical evaluation and so forth. Again, evidence can be lost or it can be, it disappears quickly, even within a person's body. So the quicker that victims are seen and evidence is collected, the better in terms of prosecution. And what was I going to say about that? In all of the facilities or communities where they have sexual assault nurse examiner programs, there's been a significant increase in the number of people coming to emergency rooms and securing forensic examinations. And I think, again, the word gets out that services are being provided in a much more sensitive way, and then it sort of reduces people's anxiety, and they're more willing to come and obtain a forensic examination in those real critical hours, those first few hours when after an assault happens. To provide a venue for the sharing of information, I've already discussed that. Enhance the ability of law enforcement agencies to obtain evidence that will aid in successful prosecution of sexual assault cases. Again, it provides a much more thorough and comprehensive way of law enforcement and prosecution to obtain information. Identify resources and opportunities for RNs or other healthcare professionals to become sexual assault nurse examiners. Again, with the availability of funding such as from this project, it really has increased tribes' abilities to have more nurse examiners available in their communities. Provide a vehicle for all appropriate agencies, tribally based or non-tribally based, to work collaboratively on developing victim-centered responses. Historically, we haven't worked very well with other jurisdictions within our tribal area, such as the federal partners and state partners where there is PL 280 jurisdiction. But this, again, it affords us the opportunity, it affords tribes the opportunity to work with those partners more collaboratively. And, again, some tribes are kind of frustrated that they're not getting real good cooperation, but I believe that, we're heading in the right direction for that collaborative work to happen. Develop discipline-specific protocols, provide cross-discipline training on such protocols, and sign memorandums of understanding. This is what really excites me, that I'm seeing tribes being able to come together and develop protocols, discipline-specific protocols, like within their tribal law enforcement agencies, their tribal prosecutor protocols, as well as their advocacy protocols. And developing those, and tribes are even receiving their tribal councils, ratification of their protocols in order to implement them. And I think that's awesome that they would be able to obtain, their tribal leadership's endorsement of their protocols. And it really kind of puts it out there that all of these disciplines are working together and cooperating and working collaboratively and sharing information with one another within a tribal jurisdiction and also outside of tribal jurisdiction with federal and state partners. That it really sends a strong message, I believe, to would-be perpetrators and also to the community that, that all of these disciplines and agencies are working really well together in providing good response to victims and also to subsequent, prosecution and investigation and prosecution. The cross-discipline training is really important, an important part of a sexual assault response team. Once protocols are developed, it's important for all disciplines to be familiar with other departments' protocols, other responder protocols. So that training is really important to provide. And tribes are all doing that in a variety of ways, just depending on the size of all their disciplines or the departments that are involved. And also the memorandums of understanding. Those are also being secured where there are SART programs. Even within adjacent counties that have CCRs, for example, they're also seeking these memorandums of understanding that those CCRs would work with the newly developed tribal SARTs in order to provide more coordinated response to sexual assault victims in investigation and prosecution.
So, Bonnie, this is Cinnamon with Redwind again. Would you suggest that programs create the MOU prior to the SART teams, or in the beginning of the SART teams before they're writing their procedures or guidelines down?
Sure, I think that would be a good idea, and there's plenty of examples of those as well, so that those MOUs are tailored to the needs of each tribal jurisdiction and their needs, because all tribes are so different in terms of size and what specific community within the tribe that this SART's going to focus on. I mean, if you look at tribes like the Navajo Nation, for example, it's huge. And one SART program cannot possibly meet the needs of the entire community or the entire reservation, I should say. So, they may have individual SARTs for, each community or each district, and then they would need then MOUs for people or service providers within that community. So those MOUs can be tailored to meet the needs of that, that community or that district, for example, and how they would work together with their local officials.
Great, thank you.
Mm-hmm. Function as a demonstration project for other tribal communities who may wish to replicate SANE and SART. And this, I think, is one of the absolute benefits, one of the most important, because like I said, some tribes are, may have had a SART for maybe 4 or 5 years and may have seen a lot of changes and, have some really valuable experience to share with other tribal communities that are developing SART. So I think it's also, that's also a good reason why tribes should participate in this work. This is just a little diagram. The green represents sort of that first tier of a SART, which consists of the advocacy program, the medical response, or could be the local IHS service unit. It could be a private emergency room, personnel, the nurse examiners, maybe the emergency room director, and also whatever law enforcement agencies are involved in that initial response. So those would be the primary, I sometimes call them the Tier 1 or the primary SART. The red and also the yellow in this case would involve those that might attend. They're not necessarily involved in the initial response where the 3 entities, the advocate, the medical responder, and the law enforcement responder, those are the ones that provide the immediate response. But the others in red and the yellow would be those that would join the ones in green at monthly SART meetings to develop, the response, the protocols, and so forth, and also just discuss what's happening with individual cases. Not identifying victims, but looking at some of the developments within each case and what's been some of the gaps and some of the barriers and challenges. That would be some of the discussions that are held at a monthly SART meeting, for example. And also to develop those protocols and then plan for the training, the cross-discipline training of those protocols. So if you look at a monthly SART meeting, it would include all of these entities. And of course, in the middle of that is the victim. I believe that it's really important that we involve victims, representation from that community as well, so that we have the voice of the victims at the table as much as possible. So this just recaps what I just discussed as far as first responders and that Tier 1. These are examples of those first responders. And then these are the additional SART ones that were in that I had in red and yellow. When I said others, a SART can be constructed however the tribe would chooses to do so. You could have community members, you could have tribal leadership, and I've listed some examples here. Prosecutors from the appropriate federal or state and tribal courts. The prosecutors aren't the first responders. They're not going to be in the emergency room where a victim presents, where law enforcement is called to take that criminal complaint, or an advocate is called to provide the emotional support, and where the sexual assault nurse examiner is called to do the forensic examination, to do the kit. But the prosecutor is part of the SART because they eventually will receive the case and review it for possible criminal prosecution. Victim witness advocates that work out of the prosecutor's office, again, they may not be they're not the first responders, but they also have an investment because if the case is charged by the prosecutor's office, they would be responsible for helping that victim through the criminal court proceedings. The Forensic Crime Lab, I think these are really essential members of a SART because they come to those SART meetings and they discuss some of the evidence that's really critical to build a strong case. Hello? So I think their participation is really important to bring them in, whatever crime lab that tribe is using, to contact individuals within that crime lab to invite them to sit in on the monthly SART meetings. Because there's some evidence that, they say is not really that important, that it really isn't really looked at and included, but there are other types of evidence that are much more important that need to be gathered in those first hours. Director of the private hospital emergency room, director of Indian Health Services, the local service unit, tribal government, tribal leaders. I know there's a SART in one of the tribes in Michigan that have one of their tribal council members on their SART, and it's just an awesome, I think, example of really seeking the support of leadership, because then that person is right there as these things are discussed and can be the voice often for the SART and represent, the concerns and the needs of the SART to the tribal council. Corrections and probation personnel. Again, this is, if we look at it on a continuum, and ultimately, perpetrators will go through the process of being involved in the corrections and probation personnel. I think their involvement is also important based on, providing that safety in the community and also safety for the victim after much of these proceedings are completed. Child and adult protective services agencies, again, those are important because, especially if a SART is developing protocols for adolescent victims and vulnerable adults like elderly victims, it would be important to have these agencies on the SART. Any questions from anybody? Okay. Staff such as counselors from maybe from colleges or university campuses in the, close to the reservation or on the reservation, such as tribal colleges. I think their involvement is really important because, as we know, rapes can happen in those settings. Mental health representatives, again, there's many victims who might need to access mental health service providers, behavioral health providers, so it would be important to have them at the table as well to discuss their protocol and how they work with patients or their clients. Social services, again, I think is an important entity to have at the SART table to discuss their services that they might have available to victims and family members of victims, either during the investigative process or after. I'm sure they have a lot of good resources that victims can benefit from. Judges and or court personnel, often we don't get a lot of judges participating in SARTs because they don't want to appear to be biased, but I think initially I've seen judges attend SART meetings just to see what's going on, what is this SART and how is it going to operate and how is that going to affect the judicial process and so forth. So I've seen them attend early meetings of SARTs just to get kind of an overall understanding of what's going on, but I really haven't seen them involved a whole lot afterwards. But I've seen court personnel involved in SARTs just to maintain that contact and communication. Tribal elders or spiritual leaders, I think they're important to have as well. Even if they're not going to contribute a whole lot, having their presence and, really I think lends a lot of credibility to a SART where they're able to provide that spiritual guidance and also to discuss the inclusion of traditional practices. Other advocates, domestic violence advocates, I think is an example of important members of a SART because, again, there's lots of overlap between sexual assault and domestic violence. Tribal, state, or federal representatives from other agencies that have a vested interest in improving sexual assault response. And again, there are many of those, within tribal communities, and it would be important to look at their involvement. This is a little definition taken from the Denver area SART. And they say that their definition of victim-centered is the systematic focus on the needs and concerns of a sexual assault victim to ensure the compassionate and sensitive delivery of services in a non-judgmental manner. This is their definition, and again, a tribal SART, a tribally specific SART can have their own definition of what victim-centered means to them. Sometimes they may want, to have something specific to their tribal beliefs or traditions as part of their definition. Just a little comparison. I think we come from a perspective of operating from a much more case-centered perspective. I always hear the language of, oh, I'm overwhelmed with cases, and I have a backlog of cases, and we I always think that, we lose sight of the needs of the victim when we have it so broad and we discuss them as case-centered versus looking at a victim-centered perspective and what does that mean. So it shifts our perspective in looking at the victim as being really an incredible or a credible part of the case, really a credible entity to the ultimate prosecution of the perpetrator in terms of their involvement. If we gain that victim's trust early on, I think they would appear much more credible, for example. So I think it's in everyone's best interest to really provide that sensitive response early on and maintain that throughout the process. So a victim-centered response seeks to, the interview with the victim seeks to identify the nature of the harm done and not just gathering elements of the crime. So this one speaks to the interview and more in particular with law enforcement interview, so that they're not just looking for elements of a crime, but they're also looking further than that, looking at the harm that was done, acknowledging the violation. I always tell law enforcement, there isn't anything wrong with you saying, I'm sorry this happened to you. It must be incredibly a difficult time for you right now. So acknowledging that violation, I think, is really important. Listen for concerns about current and future well-being. It's difficult for someone to focus on an interview if they're afraid of returning home, afraid that the perpetrator may harm them some more, may harm their children. So acknowledging some of those kind of concerns of safety and well-being, I think, is really important. If we can provide some kind of reassurance that people are going to remain vigilant and there's people who are concerned about her or his safety, I think that also provides good support for that victim, and where they can focus a little bit more on the interview and then the subsequent work that will be done around investigating and prosecution. Discuss the victim's wishes about the future of the case. And again, we hear from prosecution all the time, we can't guarantee anything, we can't guarantee that he'll be charged, but also, on the flip side of that, we always say, at least we can find out what the victim is wishing. What are they wanting? Not always do they want the person to be convicted or even charged, or sometimes they just want this person to get some help so they can stop perpetrating. So to have a discussion with that victim, I think, is really important. Address the case requirements. I really believe in the importance of providing this victim with as much information as possible so that they can make some good decisions about their involvement in this case. Because, again, we don't have a case without the victim. So to talk about case requirements, I think, is really important with the victim. Oftentimes, on the flip side of that, the case-centered interview, they're looking at the victim's credibility. In those earlier moments after a rape or a sexual assault happens, chances are the victim isn't going to appear very credible. If you think of someone who's just been traumatized in the most violent way that anyone could be traumatized, probably they're not going to appear to be extremely credible. Their memory may not be real clear. There may be a little bit of confusion about the sequence of events and so forth. And I think we really, in training, we always talk with law enforcement that, take that into account, that they may not appear to be credible, but if we're able to enlist their support, their cooperation by gaining their trust, they're going to appear more credible. So that's the victim-centered perspective. What I always ask disciplines is, what does that mean for you within your discipline? What does it mean to be victim-centered from the time of disclosure to disposition of the case? Those are some of the important discussions that I think need to happen within a SART meeting, for example, to say how can our discipline, how can law enforcement change what we do, define a little bit more what we do in terms of our investigative practices to make them more victim-centered. And if we do so, then we would realize the benefits of that by, again, getting the victim to be more at ease and more confident, knowing that we're aware of how traumatic this was for her or him, to really acknowledge the harm that was done, to really find out what they're thinking, what they want, and so forth. And how, if we're able to then put them at ease, we're going to be able to enlist their trust and gain their support. Then we've opened that door, that communication, that window of opportunity for us to work closely with that victim. So this is important discussion for each discipline to have in terms of how to provide a victim-centered response, and what does that look like. Because I think this is information that, again, can be incorporated into their protocol, into law enforcement protocol. For example, when our local jurisdiction here in our county was developing our protocol, when law enforcement presented their protocol, we asked if they could incorporate some language, some victim-centered language. For example, just language around, I know this is difficult, take your time when you're asking them questions about the assault. They may feel really kind of pressured to provide information quickly. And we asked if they could incorporate some language. Like, for example, for the patrol officer protocol, we asked if they would incorporate language like attempt to calm and reassure the victim that the victim is now safe and that what happened was not the victim's fault. And that's language that we asked law enforcement to incorporate into their protocol, and they agreed to do so.
This is Cinnamon again. I just wanted to make a comment. I think that's real important, like you said, Bonnie, to have that discussion. I think there's initially, maybe in the beginning stages of SART, where law enforcement or prosecution, some of them back away from, well, what do you mean being victim-centered? As in, it's not necessarily that they're not sympathetic to the victim, but where they're focused on their role and their responsibility, to gather the evidence or to make sure that they're complying with the law. And so some of them, it's challenging for that, and I think that's one of the key things that in doing, like Bonnie, you and Linda Ladre have been doing the presentations and the 40-hour trainings and incorporating some of that. I think it's important that they're hearing that victim-centered doesn't mean giving up their role or their responsibility, as it just really reinforces that they're hearing what the victim is saying to them.
Exactly. I always try to frame it from the perspective that, it's not just like they're doing the victim a favor, but really in the long run they're helping themselves, because if we can enlist the victim's support and their trust in what we're doing.
Thank you. Please stand by.